And we're going to start this morning with the Tri-County Health Officer, Dr. Jennifer Vines.
Good morning, everybody. Thank you for being here today. This is our effort to get timely information to the public in a very rapidly changing situation around the COVID-19 global pandemic. I'll start with a brief situation update and then get into specifics that I think people will be interested in. Multnomah County now has 2 confirmed cases as of this morning. Sadly, one of those resulted in death. That was announced on March 14th. The state continues to identify cases of COVID-19, and I'm asked why so few cases in Multnomah County. It's very hard to speculate about disease transmission and progression of outbreaks, but I can say that in general, counties that identify cases have so far been able to do contact investigation, which leads them to find close contacts of cases that may also have symptoms. That leads to additional testing and additional case confirmation. So we do know that close and prolonged contact is behind some of the spread that we're at least seeing in our numbers. I want to say that the testing situation is a frustration for all of us. It is certainly a frustration in healthcare. It's a frustration for those of us in public health. That is our tool for understanding disease location and transmission. So I just want to be very clear that there is no withholding of supplies or testing capability. We are doing the best we can. We expect more capacity on the horizon, but unfortunately, given the global supply chains that are our reality, we are having a difficult time getting both testing supplies at the clinic level and also the testing supplies at the lab level. I'm getting asked if we've tapped into federal reserves around supplies. And the answer is yes, that is a state request, and I can assure you that a lot of people are looking high and low for solution to the testing supply question. The other supply issue that we're facing fairly imminently is a shortage of disposable personal protective equipment. That includes eye protection, gloves, gowns, and masks. We anticipate that the way that we're using them now at our current what we call burn rate, that supplies may be depleted in approximately 2 weeks. We don't know when those supplies will be replenished. Again, this is part of being beholden to a global supply chain. I can assure you that people are literally working on this question right now, looking for both strategies to preserve and other creative solutions to protect our frontline workers. I want to touch on the health system coordination that's happening in the Portland metro area. We have opened communication channels with our healthcare system partners at many levels. We often do that routinely during influenza season. Many of those communication channels were quickly repurposed for COVID-19 response, both problem solving, alignment, and situational awareness. So those are the efforts that are now accelerating and that the governor is drawing on for her task force that she announced yesterday. Again, as you heard yesterday, the current modeling suggests a surge in COVID-19 patients in the next 1 to 2 weeks, but of course that all depends on what we do individually and collectively around staying away from others and slowing the spread of this virus. I'll touch on testing prioritization as part of healthcare system coordination. Right now, we are looking to prioritize testing and to sorting patients needing hospital level care into COVID-19 positive versus COVID-19 negative. This is a strategy to protect our frontline healthcare workers, preserve PPE. It also means that you may see less testing in the community until supplies and personal protective equipment come back online, which means less ability for public health to be notifying individuals and their contacts directly about an exposure. So again, we come back to please stay home if you are sick. If you don't need to, if you wouldn't otherwise get medical care, now is not the time to seek it, especially if you have a cough illness. So again, if you have mild symptoms and wouldn't otherwise seek care, please stay home. We are supporting testing of symptomatic people who are at high risk for spreading based on where they live. That includes long-term care facility residents, people using our shelter system, or anyone in a correction setting. We also still support testing of symptomatic patients who are at risk for complications because of their age or underlying medical conditions, again, understanding that there are limitations. So we're asking healthcare providers generally to increase telephone and virtual health visits for all patients who don't need an in-person, hands-on visit with a healthcare provider. We've asked our healthcare partners to cancel non-essential medical and dental appointments that require any type of personal protective equipment. You, as the public, can continue your efforts around staying away from other people and limiting your contact with others, most importantly, if you have any kind of illness, including mild symptoms. Again, only seeking essential health care. And just as a reminder, if you may not be worried about yourself or others for COVID-19, but as the COVID-19 surge comes, people still need to deliver babies safely. People still have heart attacks. People still have strokes. We need that care to be available to those who need it without putting them at risk of acquiring COVID-19 in our healthcare system. So we're working really hard on the health system coordination and expansion piece. I have a few more points. I also want to acknowledge the real downstream effects also on lives from the distancing measures that our elected officials and leaders have announced. I can assure you that we've looked at all sides of this question, understanding that other lives are directly affected in a very serious way, and you're going to hear more from the county chair and Mailer Wheeler on that momentarily, but I hope you'll believe that, again, we have not taken those decisions lightly, and we are not ignoring the downsides for people who are going to be most directly affected. I understand the fear that people have. I share it. I would ask that we resist finger pointing and second guessing. This is a very difficult situation. I would hope that we could all channel our energy into practical solutions and helping out at the individual and community level where we can. And lastly, you see me, but I represent literally hundreds of dedicated people working hard on this response every day. We are focusing on today's work, and we are doing our best to anticipate what is coming in the next days and weeks. Thank you.
Thank you.
Good morning. I'm Deborah Kafori. I'm your Multnomah County Chair. COVID-19 continues to pose the greatest challenge to public health and to our systems of care that most of us have ever seen. And ultimately, our ability to limit the impact of this virus will come down to individual behavior, clear guidance, and decisive collective action. Many of us are able to self-quarantine. We're able to maintain social distancing, and we can access the hygiene products that we need to stay healthy. But when someone loses their home, those things become close to impossible, putting them and our community at greater risk. This is why I am taking action today to place a moratorium on rental evictions in Multnomah County. We've already seen the pandemic significantly impact businesses and wages. Yes, everyone should pay their rent on time, but for people who are losing their wages due to COVID-19 and find themselves unable to pay rent, we want you to be able to stay in your home. We are partnering with the state courts and the sheriff's office to make changes that will keep people housed during this emergency. And when this emergency ends, people will have 6 months to pay back what they owe. Nobody at risk of homelessness should be removed from their home during this crisis or because of this crisis. But what if you're experiencing homelessness right now? What if you don't have a place where you can self-quarantine? What happens when the libraries close, the cafes aren't open, and public spaces are no longer available? This is why we have never wavered in our commitment to do as much as we can to protect the thousands of people in our community who are sleeping on the streets and in our shelters every night. These are people who simply don't have an option to close the front door and hope that the worst won't come. After sharing hygiene products and other supplies and taking some initial steps to space out in our shelters, I'm ready to announce another major step. In this coming week, working with our partners, we will begin opening hundreds of new beds of shelter. Beds that will allow us to follow the current social distancing guidelines for shelters without cutting capacity and having to turn people away. we will use public buildings and other spaces made available because of the emergency at hand. Most of those beds will allow shelter residents to maintain social distancing guidelines, and the rest of those beds will help us shelter people with symptoms of COVID-19 in spaces where they can receive the recuperative care that they need. We are continuing to explore every avenue as we address our highest priorities to protect this community. Last week, we approved motel vouchers for some of the people in our shelters who are at the most risk. To make sure that nobody is turned away, I am taking action to ensure that motels and hotels are prohibited from refusing occupancy to anyone from our shelters whose stay we will pay for. In our Joint Office of Homeless Services, with 14 different agencies, we have been reaching out to people who are living in camps or sleeping in their cars, offering supplies and something as simple as basic information about COVID-19. In the past 5 days, they've reached more than 1,700 people in every part of this county. Crisis exposes the character of a community, and people all across Multnomah County continue to show up to serve their community. During these extraordinary times, we will meet people where they need to be met. We will protect each other. In this county, we will not stop looking out for each other. Thank you.
Thank you, Chair Kafoury, and thank you, Dr. Vines, as well. I know you've had a very busy couple of weeks, and I can't tell you how much I appreciate your service to this community and to this state. These are unprecedented times, and obviously we're just at the very beginning of this pandemic. And already many of us are feeling the impacts. And as Dr. Vines mentioned, many people are in fear, and we understand that. But here's the thing. Nobody in this community is alone. You're not alone. We're working hard to understand, to mitigate, and anticipate the impacts to our community. We're all in this together, and everybody is being asked to sacrifice so that we can get through this situation as quickly as possible and get through it together as a community. I'm here today representing the entire Portland City Council. Commissioners Fritz, Udaley, Hardesty, and I are working together as a unified team on behalf of our community, and the steps that we take, we're taking together. Extraordinary times require extraordinary action. Effective immediately, we, in alignment with the county, are enacting a moratorium on evictions in the city of Portland. I appreciate the partnerships that have been forged between Chair Kafoury, the Board of County Commissioners at Multnomah County, and the Portland City Council, who have collectively brought urgency and commitment to this important conversation. Under this emergency moratorium, which is for residential evictions, no one can be evicted for failure to pay rent. We're moving in alignment, as you heard, with our partners at Multnomah County. This applies to those who've suffered substantial loss of income due to COVID-19 by way of job loss, job closure, reduction in work hours, missing work due to a child's school closure, and missing work due to illness to yourself or a family member. Keep in mind, rent owed to any landlord will continue to accrue. This is not a forgiveness of rent, but what it does is it buys you more time that you wouldn't ordinarily have. And as the chair indicated, there'll be a repayment grace period following the expiration of the emergency declaration. That grace period will last 6 months. This moratorium on residential evictions will last for the duration of the city's state of emergency. Now, this is just one step for keeping people stable in their homes, and every role of government has an important role to play. That's why I'm also calling upon my colleagues at the Oregon State Legislature to act urgently to increase critical rent assistance programs for the benefit of all Oregonians. We know that this crisis is already having a significant impact on our employers, both large and small. Yesterday, Governor Brown outlined some initial steps to take that can help support our state's workers. There's a lot that we can do at the local level, too. Yesterday morning, I authorized the creation of a task force dedicated solely to helping small and large employers and their employees who are struggling with the economic impacts of COVID-19. This task force covers the city of Portland. Every option will be on the table to support the resilience and the recovery of our local economy. My office and Prosper Portland, which is the city's economic development agency, are leading this task force, and we're working around the clock, and we're already moving with a sense of urgency. Today, we're meeting with downtown property owners, and Thursday, we're convening our 2 task forces and meeting with the business community. In order to help vulnerable businesses, Prosper Portland is immediately making $150,000 available in the form of grants, partnering with the Jade District Neighborhood Prosperity Network to get assistance to businesses as quickly as possible. We're asking businesses that think they might be eligible to call 311. We're starting in the Jade District because that is an area that has been amongst the hardest impacted by the economic downturn related to COVID-19, and because we have resources that are immediately available. With time, we expect to be able to expand these resources to other areas of the community. Our task force is also partnering as we speak with our major employers and small businesses, frontline communities, our labor partners, workforce development partners, and foundations, alongside key public partners from the city to Multnomah County to Business Oregon. In addition, Prosper Portland is working with the city's own direct commercial tenants and borrowers to mitigate economic impact through a deferral of rent and loan repayment for the next 3 months. And importantly, we're convening partners in the private sector to ask for their assistance in developing a commercial eviction prevention strategy as well as other financial relief. I want to thank all of the community leaders who have already proactively stepped forward to let their tenants know that they can defer or forego payments as we face this challenge together. And believe me, there are many landlords who have already stepped forward to do this voluntarily. Here's what else is happening at the City of Portland. Effective today, only employees designated as critical to day-to-day operations will be able to access City of Portland buildings for the duration of our state of emergency. This is to prevent the spread of possible infection. All employees who are able to telework are now required to do so. This also means that most Portland buildings, City of Portland buildings, as in City of Portland government buildings, will be closed off to the public. Finally, we've been fielding questions about Portland City Council meetings. They will continue. The commissioners and I will hold virtual meetings so council and staff can participate without being in the same room. Our technological capacity is somewhat limited for this week, so we have an audio-only meeting with a reduced agenda. The city has also temporarily suspended the rules for in-person public participation. Members of the public are encouraged, as always, to submit written testimony in advance to the council for consideration. And the public will be able to listen to the audio of the meeting through the city's YouTube channel or on your local TV. Public participation is obviously critical to the democratic process, but we must balance this right now with the work that needs to get done to keep city employees as well as the public safe during this pandemic. City business must continue. After we finish testing an improved system for remote public meetings, we expect to soon accommodate real-time public input as well as video. That strategy is being developed as we speak. To wrap up, I just want to say this. Yes, these are unprecedented times. Yes, in many regards it seems bleak right now. But I want people to really think about what else is happening, some of the positive things that are happening in this time of crisis. Public servants in our city and our county They're checking in. They're working around the clock to make sure critical services stay online and remain operational. People, Portlanders, all over the city are looking out for each other in important ways. I've heard stories of people making free lunches for students who can't afford them, cooking food for elderly neighbors, babysitting children who can't go to school, and paying employees despite businesses being closed and despite significant losses in revenue. What we're seeing is once divided communities are coming together in this time of crisis. What we are seeing in this time of crisis is in many regards the best of what humanity has to offer. And it makes me proud to be the mayor of this incredible city. We're in this together. You're not alone. We will get through this, and we'll get through it together. We'll continue to update you as we have more information. Thank you.
I'd also like to update the public about county operations. And please know that we are working as quickly as possible, and we'll have a website up today that outlines county services. Currently, all county library branches are closed. The student health centers at Jefferson High School and Cleveland High School are closed. And the Department of Assessment, Recording, and Taxation Customer Services, which is recording functions, marriage licenses, tax payments, passport services, and passport photos. Some of these services will be available online. This week, all of our primary care health centers and all of our dental clinics are open, but we are moving to consolidate our health services over the next week and plan to reduce dental services in an effort to focus staff resources and preserve supplies for crucial health needs. Student health centers at Centennial, David Douglas, Franklin, Madison, Marshall, Park Rose, and Roosevelt schools are open. In coordination with our school and community partners, we have coordinated food access sites for youth and families throughout the county. And we are working right now to ensure that there is access to other vital human services for our elders and those experiencing domestic violence. Our Multnomah County board meetings and briefings will be held virtually, similarly to the City of Portland, so that we can continue to conduct critical county business as needed. The public will have access to the meeting from their phones or computers. In accordance with our emergency declaration, I am suspending all non-essential agenda items and requests until further notice. Public testimony will be accepted in written form on agenda items only and can be sent to our board clerk's office email address, which is boardclerk@multco.us. Information on how to tune in to our upcoming board meetings, instructions, and information will be posted on Multnomah County's website as soon as we have finalized them. And now we would like to take questions.
Yeah, what about a landlord who maybe owns one or two pieces of property, if he or she can't pay the mortgage because the rent's not coming in? What is he or she supposed to do?
Right, we're working hard and working smart to try to mitigate these circumstances. But right now, our highest priority is to limit the spread of this disease and to ensure that people get the care they need.
I'm meeting with some of our banking partners on Thursday, and just as we were asking building owners and landlords to make sacrifices, we're going to ask our local banking and credit union partners to make sacrifices as well. And one concern we have is that as tenants are unable to pay rent, landlords and building owners would then not be able to pay the mortgages that they are due. So we happen to know that the banks are sitting on substantial reserves. We know that we have local banking officials who are eager to help, and they've asked how they can help. And I will explicitly ask them how they can help give a little more coverage to landlords and building owners to help them get through what will obviously be a cash flow crisis.
Another question, has anyone thought of using the Wapito jail for any of these services that you're talking about?
Everything is on the table in a time of crisis. There are many offers that are coming to the city and to the county. We're gratefully accepting all of those offers of assistance, and we will weigh those through the Joint Office of Homeless Services if it's related to homelessness, and if it's related to public health, we'll rely on our public health authorities and medical experts.
Mayor
Hi,
Rogers.
thank you.
You're not-
Bridget Moore,